This is a patient of mine. He's 32 years old. He was skiing or snowboarding, and he's had a very heavy fall onto the shoulder, and he suffered a posterior dislocation of the shoulder. Now, posterior dislocation is significant because they're relatively rare. The most common sort of dislocation is an anterior dislocation. Over 90% of dislocations are anterior. Posterior dislocations account for about 10% of dislocations, and this is a nasty posterior dislocation. So you can see here, this is the MRI scan. This is the back of the shoulder, this is the front of the shoulder, it's a cross section. This is rotator cuff at the front, rotator cuff around the back, this is deltoid. And this is the socket here. If you see the bony outline there, that triangle there is the glenoid or the socket going back to the shoulder blade. The grey layer is cartilage, and look here, there's no cartilage on the back of the glenoid there. There's a big chunk of cartilage that's been chipped off. That's labrum, that black thing there is labrum. That's fiber cartilage. That is normal at the front, and it should be mirrored to the back of the shoulder, and there's a tear down through here. The shoulders come out here and then hit back here, and there's a little dent in the front of the shoulder there. So this is a nasty posterior dislocation. There's actually a piece of bone down here, and the labrum is off. That's what we call a reverse bony Bankart injury. If you look here at the CT scan, this is a CT scan. It's a 3D recon of the CT scan. If we can spin it around, you see this is where the fracture is at the back of the shoulder here. This is where the shoulder, the humeral head has come out here and then gone back in. The front of the shoulder is actually all right. I'm going to show you the CT scan of the other side, the side that's uninjured. So this is the left shoulder, this is the right shoulder. And so I think you can see the difference there. We can spin both these around. So this is the uninjured side. You can see this is the back of the shoulder here, and this is normal. And this is what it shouldn't look like. That there is quite fractured. See a little chip of bone down here. It should look like that. There's a lot of bone missing from here. The other thing I'm going to share with you is the CT scan of the humeral head. So this is the other side. I'm just going to show that to you so you can see the whole bone there. And what we're going to do is spin it around, and there is a dent here at the front of the shoulder. It's subtle, but it is there. There's some denting and injury to the front of the shoulder here, so that is a reverse Hill-Sachs type injury, and there's some cartilage off there, I believe.